This is the Situation Room, the only way to start your day.
It's a certain outcome. But when you compromise the application of the law, that's when now also we compromise the quality of what comes out. Absolutely. And we start saying, no, we need a dictator. It's not a dictator that we need. We just need somebody who, they understand the job and they follow the stipulated regulations to the very end.
True.
And we also hold them accountable to the same.
Yeah. Exactly. So now,
Yes.
Aseto, you made it easy to compensate somebody across board, and you're saying that you can actually save money, you can do it in USD, and that you can instantly, so long as this person has this other wallet. All right, how does this work?
Yep. So here's the situation, right? So you want to do business with individuals from Tanzania, right? So how do you need to pay them? You know, there's the old school way of doing things that takes long and people have to wait on the line. The risk is actually there, but Sendwave is telling you all you need to do is download the Sendwave app, and that app will enable you to make payments instantly. You're able to, if someone is sick, you're able to pay for that immediately. You know, it is something that I have done. I've been able to save someone who was in distress, but all they needed to do is have the Sendwave. But when you send it, right, you send it in dollars, so it is your dollar account.
Okay.
Everybody wants to have the dollar account one way or the other, so that when it goes up and whatnot, you're able to withdraw when you really need it. So you send it in dollars, the person on the other end will receive it in dollars and be able to withdraw it in their local currency, right? But aside from that, they can also choose to use that as a savings mechanism. You as an individual with Sendwave app, you're able to load and have that money there and use it when you need it. All that is needed for you is to download the app and wait for money to come, or for you to load it as your savings mechanism.
Okay, so you download the app, you can save money, send money, or you can receive money. Right? And all you need to do is tell the other person that you're communicating with to download the Sendwave app. And we're talking about no fees to be able to send this money. And so this is definitely the way to go about it. I love it. Love to hear it.
And remember, the transaction you're talking about is instant. So there is no wait time. There is no waiting to you for clearance from anywhere. I send it, you receive it, then you decide to do what it is you want to do with it.
Absolutely. That's it. That's what we're doing with Sendwave this morning. Our Healthy Friday conversation shifts gears a little bit, and we're going to look very closely into issues around childbirth, inducing birth, medical need, or is it an unnecessary risk? There are lots of women who will go to and say, okay, I'm done. I'm ready. Let's go. But we're going to look at the details about all of this today. Nereah Mlale Ojanga is the director of Midwife Nereah, and she joins us in the Situation Room this morning. Good morning.
Good morning.
How are you doing?
I'm very well.
Karibu Sana. Welcome to the Situation Room. Getting into this Healthy Friday conversation today, and we're glad that you could join us.
Thank you.
First of all, we are going to start with what we normally do, today's proverb. Dennis takes us to a different African country, right? And I promise not as difficult as labor. He is going to share today's proverb, and we'd love to get your interpretation of it.
Yeah, so interpretation today, rather the proverb comes from Cape Verde. Also, the locals want it called Cabo Verde. So it is a country that has beautiful beaches where tourists come to visit, and their currency is equally pegged to the euro to help deal with inflation. But the proverb that we have today, gratitude is the memory of the heart. Gratitude is the memory of the heart. How would you interpret it? What do you think the people of Cabo Verde are saying through that proverb?
Attitude is the memory of the
heart. Gratitude is the memory of the heart.
How would I interpret this? Gratitude means you are grateful to somebody who has done something for you, and it really has to come from the heart. So it's not something you'll be rehearsing. It is something you always carried.
Okay.
So it's not an instant thing. You always are grateful, or you have gratitude for whatever somebody has done, big, small.
Okay. Great to hear. So we're looking into inducing labor. What does that mean, first of all, when we talk about inducing labor?
Thank you. Inducing labor means you are trying to get the uterus to contract abnormally. I would say that. So you're not waiting for labor to come. You're going to start it artificially using various means. Yeah.
How?
There are several ways of inducing labor, and we have the medical side where you're using medicines, and we have the other side which is we call it mechanical. So inducing labor medically means you are going to either you are going to the hospital, actually, because medically you have to be done in the hospital. You are going to the hospital, and there are two types of medicines. They are either going to induce labor using what we call prostaglandin, which is what the body usually brings out towards the end of pregnancy, or they are going to use something called oxytocin, which also is produced by the body, but now this one is synthetic. The mechanical side is where you are trying to make the cervix dilate, because the cervix is the cervix is has to open up for the baby to pass through. So you are trying to excite the cervix, try to make it dilate. So you are either going to do something we call membrane stripping or membrane sweeping. Or you're going to use a balloon, you insert it through the cervix and then wait for the cervix to open and it falls out on its own. Or you're going to break the waters, what we call premature rupture of the membranes, and then hopefully now the lady will pick up labor and get into labor and deliver the baby.
One would ask then, what circumstances would lead to birth to be induced? Can I just walk in? I can't walk in. My significant other walk in as.
Thank you.
Right, let's put it in perspective. My significant other walk in and just say, yeah, we need to walk in and say, because I'm expectant, my days are here, induce me because I don't want to wait for it. Maliza niende. Can someone do that? Or does it come from the midwife, from the doctor, from the gynecologist? It's them who advise, or as a patient, as a customer to a hospital, can I ask for it?
You can ask for it.
Okay.
Depending on various circumstances. I have a privilege of working in a government hospital, and I had a privilege of also now in private, now working with the private, practitioners and practicing my midwifery. Then I'm looking at a government hospital. In a government hospital, things are laid out. You follow processes, you follow protocols. So in that area, you will not walk in there and say, can I be induced? There will be things that will make us induce your significant other or a mother who is, we're thinking, for you to get induction, there has to be, we are looking at the maternal side and we are looking at the baby. That means it's no longer viable for this baby to continue in the mother's uterus because of the circumstances that could be prevailing. These circumstances could be maternal, could be the mother. Maybe the baby has gone well past the due date. We talk of 40 weeks for the baby to be in the uterus, but 40 weeks plus 10 days, the baby has not come. We have to get that baby out because the baby feeds through the placenta, and the placenta has a shelf life.
Okay.
So that will be one circumstance. Could be mother has high blood pressure and the baby is no longer able to contain that pressure in them. It could also be maybe, diabetes. So maternal conditions that will make the baby, we need to separate this baby and allow them to get out and survive without their moms, without that placenta feeding them. The other thing could be the baby themselves. Sometimes you find because of maybe maternal issues, then the baby is not thriving. There is intrauterine growth restriction or retardation. So this baby is supposed to be maybe at 38 weeks, the baby looks 34. So that means this is a baby, if you don't get this baby out, they are on their way, to some maybe demise or something like that. If a mother woke up and broke her waters, what we call premature rupture of membranes, you have to induce this mother to get this baby out, because then that protection resulting from that baby in the uterus now has been broken, so there will be ascending infection, and we don't want this infection to reach the baby. There could be other, now in the private now, then you'll walk in and say, we need to go to South Africa for a holiday and we need to go with our baby.
Okay.
Well,
Yeah. So please just pop out. Yeah, we need to go.
We need to go. Allow me to ask.
Yes.
Giving birth is supposed to be a natural process. But then you cite various complications that arise, and they demand an intervention.
Yeah.
That is where the induction now comes in, to try and save the life of both the mother and the baby.
Yeah.
But something that we really don't talk about, because perhaps we don't know, I just want to seek your indulgence on this. From conception, does the specimen of the father have a relationship on the development of the baby that could lead to now these other complications during delivery? Or is it purely a mother take care of the process, and then when the delivery time comes, we'll do our best? Does the father, that's what I'm trying to ask, the role of conception, does it have a correlation in this developmental process of the fetus all the way to the point of delivery that could warrant or bring about some conditions that could complicate now the delivery process?
Apparently, I would say very little happens to be coming from the father, because if the mother is, for example, let's say she's O negative, it doesn't matter what the father's blood is. Even if the father is negative, it does not affect the management of that mother, because it is the mother who is carrying all this. It is the mother who is feeding this baby. So, other than now looking very remotely, if now maybe the father came in, maybe HIV positive and infected the mother, then that changes the whole scenario. Yeah, but the father usually doesn't appear anywhere. But interestingly, these babies start relating with their fathers at a very early age, a few weeks, like they talk of 11, 14 weeks. They can feel their father. They know this is my father, and they start communication from there, and even right up to delivery.
Are you paying attention then?
Right up to delivery.
Right.
And having interacted with millions of mothers, having been a midwife for over 35 years, this, I get to find that very often, that when the baby hears the father coming through the door, "Hi, babe," the baby jumps in there and they're very excited. When the baby is restless, the father puts the hand on the mother's belly and says, "Hey, baby, keep quiet." Thankfully, these days they are able to know there's a boy or a girl, so they're able to, they've even maybe probably given them a name, and the baby will keep quiet. If the mother says, "I've had the whole day, the baby has not played," the father will put their hand there, or they'll talk to the baby, and quickly the baby listens and goes, "Oh, so daddy's around, you're not all by yourselves." Yeah. It's a result of communication.
So there is that, and it's good to know, because even as men, you need to be very supportive of this process.
Please.
Now,
very important for good outcomes.
yes. Fast forward. Now, when it comes to the outcomes, when the delivery doesn't go as naturally expected and there's need for induction, there are cases where that has not worked out, either for the mom or for the baby. But what are some of the conditions that develop from the complicated delivery for the baby?
During induction or?
After induction, the baby is born, hopefully, and they are alive. But there are some instances, complications have come up in terms of the milestone and the development of the baby. When things don't go right, I'm saying this because I've had friends mothers who went for that epidural thing, the induction, and somehow either the labor went on for too long, and then the baby, there was delayed delivery, the kid comes out, and some complications start to develop on the baby. But what are the main, when there is a crisis, when the induction does not go right, when there is a crisis, how does it affect the baby?
Good. What happens when we are going through induction, we really have to make sure that all our antennae are really up, because you are inducing a mother, you're exciting this uterus. Earlier on, when we're doing oxytocin, it used to be like really, really painful. And since you're exciting this uterus, the uterus has a way. I usually think the uterus has a brain of its own. So you wake it up and you're exciting it and you want it to contract. It will be like, I want to evacuate this baby. So it is violent. And that is found in research. So usually the contractions, the normal contractions will come. In fact, they start so subtly, 1 in 30, 2 in 30, 3 in 30, 20 seconds, 40. Then you move on to now 1 minute, and that becomes really, really tough. But you might find when you start induction, you're already at 30, 40 seconds. And this baby has been quiet there, having, just enjoying themselves. Yeah. And suddenly they are being crushed by this uterus. So what happens, they will give a signal. And because these people who are inducing are already, I'm imagining it must be in a hospital, they have all these gadgets. Today they have a lot of gadgets. So they're able to pick this baby is getting distressed by the fetal heart. So they monitor the fetal heart very closely. And if the fetal heart goes to acceptably high or goes acceptably low, then they quickly have to change that. So you will not induce a mother in a place where you don't have a theater. Because quickly we have to revert that and go to theater. Yeah. So the complications will be, if you allow that to go on a little longer, these are the babies then will come out with either cerebral palsy, they have delayed milestones, because the first thing that happens, if they do not, because when the uterus is contracting so violently, it doesn't allow the baby to take in enough oxygen. And if they don't get oxygen, then that means the brain is not getting enough oxygen for them to. But now that is in extreme cases. Yeah, that is an extreme case.
Are these complications explained to mothers before it's actually done?
They are told everything. They have to give consent. Yes. So you'll not put a woman down, I'm going to induce you. Because first of all, they'll have been taken through, there's 9 months of preparation. Yes.
So that speaks to then the importance of clinics for women to be taken through the entire process and even be explained to at what point perhaps induction could be done and what circumstances could lead to that. That therefore, even when someone wants to come and say, because I'm going to South Africa for holiday, I want it popped so that I can go, that there is the background information, the background processes that have to be undertaken, and that if anyone finds themselves in a situation where, first of all, we do not have a theater around, but you're being told we can induce, it's an opportunity, or those are red flags that men should be able to pick up on.
Yes, for sure, for sure. Because even that baby, now from experience, babies will go up to 40 weeks, especially where you are very sure this baby is supposed to have come today, but you have given them 10 days and they have not been born. You kind of have an idea. Like now, you kind of know if this baby probably is not sitting well, or this baby is too big. The uterus itself knows this is dangerous. The uterus, I told you, has a brain of its own. This is dangerous. I don't want to contract because this person is huge. And so we kind of have an idea. So when you are inducing, and mothers will be taken through this. I know a number of doctors, obstetricians will be taking their client through, and some of them will tell you if you go 40 weeks and you have not gone into labor, on the 40 plus 1 day, we'll actually admit you and get to induce you.
Okay. So you've talked about, what you introduce for inducement is that the word? Induction.
Yeah.
To take place, right? Mm-hmm. Inducement is something else. But are there natural ways to induce labor? There have been many things that we've heard. Well, if you eat chili, I don't know, then it'll hurry things along. If you have sex, it will hurry things along. If you eat, there was something else they said, chocolate or something like that. Is this true, or are these myths? Because the assumption is that there's an injection that's given to induce labor. There's medication that's swallowed to induce labor. Mm-hmm. But are there natural ways of doing this same thing?
Yes.
Okay.
I talked about them when we started. I didn't talk much about sex, but it has been known to induce labor also.
Okay.
Yes, because of the prostaglandin that is produced at that end. Mm-hmm. Then we have the sweeping of the membranes, or the tripping of the membranes. So that means, and actually before you even start that induction, you have to be checking the most important organ here, or the most important thing that we check is the cervix. Mm-hmm. Because if the cervix is not ripe, what you call ripe means when a mother gets pregnant, the cervix tends to become, it is long. Mm-hmm. Long, we are talking of 3-4 centimeters long. Mm-hmm. It is usually hard and partly, looking at the spine, pointing to the spine. Towards the tail end of the pregnancy, then the hormones that are produced will reduce that length. Mm-hmm. And sometimes you find it is maybe like 0.5 centimeters. It is soft, and a soft cervix then can be able to start dilating. Mm-hmm. So you will not be introducing anything until you check on the cervix and say, okay, because the whatever tablet you talked about, which is either put in the tongue or sometimes even put, in the birth canal, is essentially to work on the cervix, because we need the cervix to be good for the success of induction.
Okay.
Yeah.
And I'm still going to the babies, because I think that's where my heart is.
Okay. It should be there.
Are there any pros and cons, one would say, devoid of any medical risk that the mother might be facing? Let's talk about the case the couple that wants to go to South Africa. Now they've come in, they've demanded an induction so that they can, pop and go. But are there any known or perceived risks? Or rather, if you compare the natural way of laboring versus the artificial way when it comes to the baby, because you said once you induce labor, it brings this rapid contraction, which shakes up the baby. They were not yet ready at that moment, but they've been now called out to step out of the house and come into the world. Unlike where they are left to naturally let the process come when the mother, starts laboring, as you said. When you compare the two, for the baby specifically, what are the pros and cons?
As we prepare the mother for induction, yes, we have to talk about the baby. Because if the baby starts showing signs, that is the reason that we'll go to theater. Now, whether there was a book trip, or of course that is not true. You can't deliver and go to South Africa. But we take in consideration, other than looking at the cervix, you also look at the baby. I have heard of cases of mothers who have gone they were planned for cesarean section, for induction today. And then they went and the doctor feels this heartbeat is a bit elevated. You can't continue with induction. We can't continue with induction. And what happens today, one of the processes that you have to follow is to put that baby, you have to listen to that baby's heart for 30 minutes to make sure that, because sometimes babies also all get to know, like, I'm here, so and this is not a safe place. So they start. So they also bring up their their heartbeats, because if they are scared, their heartbeat will definitely go up. So you have to let the baby settle down, and you are able to tell this baby was kind of distressed a little, but the fetal heart now has become good. But if there was anything that you thought this is not right, you quickly change the plans and took the mother for emergency section.
Okay. Well, I'd like to take a break at this point. Then we come in and continue this, because there's a lot of women who are thinking, okay, well, you know what? If you're going to count, and I'm ready. My due date was 23rd of July, and we are at 23rd of July. Is it always the best solution to take, where we come by and say, okay, Daktari, induce me, let's go? We'll have some other questions, and then how to deal with some of these complications. Sometimes you don't like to talk about it, but I think it's necessary that we do. As we go into this break, remind us, it's getting into the weekend.
Yes.
Folks will be looking for you to maybe send something to them, whereby you can actually, send it without too much of an issue. How do we do that?
Yes, you do that through SendWave. And let me tell you one thing about SendWave that continues to stand out, is that when you send your money to the other individual who has a SendWave as well on the other end, it's instant. There is no delay. There is no holding.
This is the Situation Room, the only way to start your day.
Certain level. Yeah.
Okay.
Yeah.
We obviously talked about the dangers of leaving the baby in
Yes.
for too long.
Yes.
What are some of the dangers that we see from induction?
The dangers from induction, maternal, is they'll usually get much more severe labor than mothers who naturally, went into labor. And this is informed by the fact that the oxytocin, which mother produces, is usually it crosses what we call the barrier, the brain to, so it kind of, because oxytocin is a love hormone, a happy hormone. So the mother will get into contractions, but she will be able to bear it because it's not as severe. The other ones, because of the excitement, then they can't cross the barrier to the brain. So the mother actually has, they're getting that neat labor. Of course, mothers will always get into fear when they're going into induction, and fear is also one of the factors that will prolong labor, because, and of course, a lot of mothers, when they come into labor, they had their own labor, they were already contracting, but once they get into labor, they are scared, and what happens? They start releasing adrenaline. Oxytocin and adrenaline do not stay in the same room, so that means until she settles down, she will not pick up that good labor. Yes. So then the baby, we say the baby was not ready. Then the uterus is hypersensitized and it is contracting, and so that could also mean the baby is not getting enough oxygen. The baby is not resting. The baby is not feeding. So that could be a danger to the mother. The other thing is when that happens, they might go through labor and deliver with all those circumstances, but it also recorded that mothers who have been induced, they also run a risk of more bleeding than mothers who have gone to labor naturally. And babies also who have been born, according to research, they also tend to be more distressed as opposed to babies who have been born by mothers who went into labor naturally. Yeah.
So does this same process happen where preterm labor comes in? Is it the same thing that you're looking at, but that has just happened earlier?
Now, preterm babies, remember, they also, depending on which stage, because we have late preterm, and we're talking of 34 weeks. These are good take-home babies. I mean, you deliver a 34-weeker and you can actually go home with the baby. But now you're talking of 28 weeks, 30. Those are severely small. So they are babies you don't want to gamble with, because first of all, their lung tissue is not well mature. So if it is not feasible, please take them for cesarean section and get this baby without distress, because we are looking at already a small baby with very immature organs. Yeah.
So sometimes you have gone through the process of inducing labor, right? And then you still have to go for a cesarean section. What didn't happen? What did not occur? Whereby the lady still has to go for a cesarean section even after having been induced.
We talk about the cervix opening. As a midwife today, I no longer celebrate a fully dilated cervix, because the cervix might be fully dilated, but the baby is not sitting properly. So if that baby is not coming down the normal way, there is nothing you can do. I know sometimes we talk of something called vacuum. If this baby has come down, and because the mother has gone through this, this rough patch of labor, then the baby is down there, you can actually see the head, then you can use something you call vacuum. But if the head is high, there is nothing you can do. You have to take this mother for cesarean section. And she has endured labor until she's almost pushing. Yeah.
So we find ourselves in a... Nowadays, whenever our significant others go to hospital, there is more insistence on CS. Also they call them the youngins nowadays.
Yeah?
The youngins, the young ones, eh? Yeah. Yeah, they prefer to go through the CS, right? Simply because I don't want to feel the pain. I don't want to go through the processes. I want my vitals to equally remain in shape. I don't know what that means. But therefore, you find that many find themselves having conversations on induced labor. Someone has gone through it and they're encouraged to go through that. So how does one then come to a professional, to a midwife, for guidance on what is best suited for them? Because during pregnancy is when one gets advised by everyone. Those who've gone through the process, those who think they know what is best for you. There are those who equally want you to go through what they went through. How does one combine all this information coming from different quarters to know what exactly is best suited for them, so that when they're coming to hospital, they are advised by a professional, but having heard what everyone else has said?
Thank you. Very important. There's even Dr. Google.
Oh, yes.
So, ladies need to know this. When you get pregnant, especially not fighting, but just thinking of the middle class woman. Because she's busy, she's running a busy office, and so she doesn't have time. She goes to see the gynecologist or the obstetrician. Actually, they're obstetricians, and the obstetrician has this. She's also a busy man or a busy lady, so they don't have these classes. That's why midwife Nereah is here. I run a Lamaze class where I take women through all this.
You have to tell Joe what Lamaze is.
Yes,
That's what I'm
please.
saying. Lamaze is childbirth education. So we are going to start where you are. You come at 12 weeks, we start from 12 weeks. Why are you vomiting? Why are you... What is this that you're feeling? Some of them are not able to
Why
sleep.
are you angry at Joe?
Yes, because the hormones are all over the place.
Right.
So then we come down. Of course, and when I do that class, I want Joe to come with a significant other so that they can be supported through this process. And then we go through labor and we talk about it. How does it start? How can you withstand, And surely it has been recorded, it is a research thing, that when you have your significant other, I happen to be also a doula, and you have a doula, then you are in a safe place, because then
Please
you
tell
have
Joe who a doula is.
I will. I'm just... Yes, and a doula is a lady, or it might not be a midwife, but now being a midwife now gives me like a plus, because then I know when the doctor says the cervix is this, the baby is like that, then I can break it down to the mother. So a doula is somebody who goes to labor ward with the mother. So in as much as I'm a Lamaze a childbirth trainer, I'll also you take them through. They are very confident now. They know. Even when they check Dr. Google, they'll come to class. They'll call you and say, "No, I had this, I had the other." Then you are able to put things in perspective. You are able to debunk a lot of myths and falsehoods. And then now you have gotten into labor. We are going to the hospital. I am there. Your husband is there. And we go through this labor, and the report that I've gotten, the feedback is fantastic. Yes.
Now, before, remember to tell me and
Have a private
my spouse,
conversation.
no, and the viewers as well, where we could come for this Lamaze class. Is it online? Is it physical? Just remember to tell us where. But now I want to speak to the Mama Doula in you.
Okay.
Because now, recently, it has become pretty common for the water bath. Or I call it water bath. I stand to be corrected.
It is.
Explain to us about that. Maybe the advantages and the not. How is that?
Water bath is water bath is actually being in the water You get into labor and you get into the water, and you deliver in the water. I am also a trained water bath. I can deliver women in the, but it is not. It is not an African. It's not an African thing.
Auntie Nereah, please, you have to explain that we're not saying get into a swimming pool.
No.
Where is this happening?
The
Because they
ocean,
get into the water in the ocean.
We have something called pool bath.
Okay.
So you have the pools. Then you pump them up, fill them with water, and this water will be the temperature the mother wants. Remember, when the mothers are in labor, they usually get very warm. They are sweating. So the temperature of the water might even be cold, and you're feeling like, but the woman is happy. According to research, it has been shown that if everything held together, if you have 2 women and you're going to go into labor for 5 hours, this one in the water will go 3 hours and deliver.
They didn't tell us this thing before. It's not fair.
I'm here.
Mama Dula is here.
Why didn't they tell us?
So the mother gets into the water. I've delivered like 2 or 3, but it's not. It's, a lot of them are like, my baby will drown. The mechanism of how these babies come out will not allow them to drown because of the fact that babies will be born and they will be given like 30 seconds while the placenta is still attached. So they're still feeding from their mother. And 30 seconds is a lot of time to get the baby out of the water.
Okay.
Yes, so the mother gets into the water and they actually labor in the water. You talk to them, they can even take their whatever they want to take, their meals in the water. They can do a lot of movements in the water, and the water has a calming effect. And when they are in the pool bath, then the buoyancy of the water helps to calm them down and reduces the effect of harsh labor. Yes.
So the water in this case has to be a bathtub.
No, we have pool baths.
Pool baths.
Yes, we have pool baths.
Okay.
You know, when you say water bath, it can be shower, tub. So
Even in cases where a mother is in labor, sometimes you get an opportunity to put them in the shower.
okay.
That this is now water running from the shower, really, and just falling on them. It's very, very
Calming.
calming.
Okay.
Yeah.
That's interesting. There, still, of course, I mean, all of this is an entire process where different things are happening at the same time. There's a question about whether prolonged labor, which we've seen a lot of women, I mean, I don't even know how they do it. People are in labor for 20, 24, 20, 30, 40 hours of labor. One would have hoped that by that time there has been an intervention that has been introduced to then stop that. I mean, for a CS, because my God, to do that is crazy. But then do we see effects on the child as a result of this prolonged labor? Many have linked autism to prolonged labor, that the child comes out after being in this, because they're in distress too. The mother's in this horrible distress, but the child also at this point wants to come out. Do we see that there is a link between then some of this, like now being on the autism spectrum as a result of prolonged labor? Is there a connection?
Autism seems nobody can actually say this caused autism.
Okay.
But more of cerebral palsy than autism if labor goes that long. And in a lot of hospitals, we have a chart where labor is not supposed to go beyond a certain period. We talk actually about 12 to 18 hours. And out of those 12 to 18 hours, the uterus is still the cervix. The cervix is deciding whether to open, whether to let the mother sleep a little. So a lot of time is wasted between that time when she's supposed to get into active labor. But once the mother has got into active labor, she has to go like 6 hours. If she goes beyond 6 hours, then that one is not good. Yes, and then we have this. Currently, we have the gadgets to be able to tell us we are not doing well. So you not see a mother in a hospital who has gone into labor for more than 12 hours.
Okay.
Yeah.
Okay.
Yeah.
How critical is it for an expectant mother to go to a hospital, to be part and parcel of the entire process with a professional? Because you find there are those who, like you say, we Google, right? We'll hear advice outside. But how critical is it for one to go for ante and post?
Very important. because then.
And how does that then
Sorry.
contribute to the final decision that would be made on delivery? How critical is that?
I'll talk about antenatal. First of all, when the mother falls pregnant, there are things that are done for her. There are some of the medications that are given that so that we prevent certain conditions of the baby. Like if babies who are born with hydrocephalus. Hydrocephalus is a big, an opening in the brain, and the cerebral fluid accumulates in the head. That one now, there are supplements that are given to stop that. So we want them to start before they are 12 weeks. So very important. And then you also want to check her blood, especially for first-time moms. What is her blood group? Because then we start intervening early before the things go haywire. When they go to the hospital, then you take their blood pressures, you take their weight. Because if a mother puts on like 10 kilos in 2 weeks, then there's a red flag there. Either they are accumulating fluid or there's something they are doing which is not right. We also have to check what they are eating so that they are not snacking, they're not taking chips and chicken, they're not doing, because that will make the baby, as they put on weight, they also give that weight to the babies. So that at the tail end, we have a baby that will be able to pass through the mother's pelvis. We also have to advise them on sleep and rest. There are some ladies, they are just like you are just running your show in your office like everybody else, and sometimes you're feeling sleepy, but then you are in this big meeting and you have to, and the body is telling you slow down. So we tend to tell the mothers to listen to their bodies, to rest when the body needs to rest. Then of course be able to debunk a lot of myths and to be able to tell them why they are going through certain things. And yes, rest. Then to start preparing them. Labor, pregnancy, labor, we have to prepare them for breastfeeding. So they have to know, even when you go through certain section, the baby needs to feed. Then they have no issues that you have a scar or whatever, or you are sleepy, they want to breastfeed. So we'll prepare them for breastfeeding. That it's very important, because how you handle the period between the time she falls pregnant and the time she delivers, then will translate whether she's going to have milk for her baby, whether she's going to develop what you call postpartum blues. Postpartum blues means she's moody, she cries, she might not, extreme cases, she might not even recognize this is her baby, and so we need to come in and rescue the baby, because if she doesn't recognize this is my baby, she might harm the baby. But those are extreme cases. And we encourage the men to be in this, together with their wives.
Yes. I hold your hand.
Because, yes, it's very important. Talk and touch are very powerful to the women, and especially when they get into labor. Yeah.
Which is a tricky situation, because in my experience, I don't know what you would say, men have not experienced a very happy labor session. We have never been liked during that period.
By who?
By
the people who are laboring.
By the one who are laboring. But nevertheless, we blame it on the labor pains.
Yeah.
But you mentioned like the postpartum blues, and sometimes there has even been postpartum depression.
Yes.
And you see that affect the relationship between the mother and the child. And a while ago, our society was looking different. Young mothers or girls who are pregnant would be advised by the auntie or somebody who has given birth before. But now the current setup of our society is changing. You realize there is less and less social support for the pregnant woman, unless they go to a clinic, and sometimes the professional services are not easily accessible for whatever reason. But were there, and then we don't want to rely on Dr. Google as well. But where does this leave the need, especially as you say, for the mamadula, for the person who works with the pregnant woman? Where does it leave in the modern society? What can the young woman who is pregnant do? Where do they go? Because the process remains the same, just the social support has changed, and sometimes it becomes a very, in instances I've seen, a very solitary process that could lead to the person might be healthy physically, but then emotionally, the emotional health of the mother sometimes goes unaddressed.
Yes, with sometimes having information overload. That is why we are really, fighting this space to make sure that mothers, because the social fabric for sure is not what we had. In-laws, mother-in-law, and father, and your own mom coming to stay in your house. We are busy as mothers-in-law. And even if you're not busy, we are not wanted in that home because you might bring something which is contrary, because So that is how you will find a child education. Work with a midwife. Even calm your baby how you're supposed to feed your baby, because sometimes babies also get to imagine, I've been here 9 months and I gave you all the opportunity to learn these things. How come you didn't learn? And they're very unforgiving. And so they'll start at midnight and scream for 3 hours. And not that they want anything else, but they just want to make sure that you talk to them, or you hold them, you cuddle them. So it's a tricky situation. Probably now looking at it, how many are we? But very, very good, very nice to know that a lot of mothers who go to mainstream hospitals, the clinic which I ran in Kenyatta, Clinic 18, you will get all that information, because every morning before the doctors come in, we'll take you through what are you supposed to do, how is breastfeeding, how is labor. I would also come and sit in that clinic and tell them about labor. And of course then tell them, don't scream. When you scream, then I know you didn't come to my class. So I started this a long time ago. So they are taught and they can ask questions. And midwives are very critical, because you find a mother has gone to see the doctor and they're finished with the doctor, and they'll come out and talk to the midwife, so the midwife breaks it down. So when the doctor says, I need to take these 2 tablets, what does it mean? So then you explain to her, you're taking this tablet, 2 of them because of this and the other. So midwives are very critical in pregnancy, and I know we are coming up very strong to win our mothers, and we win their confidence back.
Well, you mentioned something very key. The need for Dennis to be a present pregnant father because of the essence of touch and talk.
Yes.
But then you have a woman on the other side who says, I just
Don't
want
touch
to